February, of course, is Black History Month. Today, we're shedding some light on health issues that impact Black and African American communities at higher rates. Specifically today, we're talking diabetes. Joining us is Dr. Kehinde Eniola. She is with the Cone Health Family Medicine Center to share practical, vital recommendations and information to help prevent and manage diabetes every single day of the year. So let's just start there at the basics. Why are Black and African American community members at a higher risk for diabetes? And then how concerning is it if they just kind of like leave it alone?
Well, Tanya, there are various factors that can predispose African Americans to having diabetes, one of which include biological factor. Also, socioeconomic factor is a big deal. Talking about biological factors, studies suggest that African Americans have increased risk of developing insulin resistance as well as obesity, both which predisposes them to having diabetes. Now, food insecurity is a big socioeconomic factor in this patient population, limiting their access to healthy meals that are rich in protein, low in sugar, carbohydrates, and fat. Economic disparity is also very important, limiting their access to physical and wellness centers where they can exercise to improve their overall health. Now, if diabetes is left untreated, Tanya, it can lead to severe complications that might impact their quality of life and also limit their life expectancy.
Okay, so let's kind of like break it down a little bit. For people diagnosed with diabetes, let's talk about maybe the top 3 lifestyle changes that they should prioritize to control their blood sugar.
I believe the top 3 that we should be talking to our patient about include healthy diet, regular exercise, and stress management. Stress, as we know, can increase serum cortisol level, which is a hormone that increases blood glucose levels, subsequently leading to diabetes. Now, our diet should include fruits and vegetables while reducing the total amount of carbohydrate and glucose that we have in our diet. Exercise is very important, Tanya. You know, the American Heart Association recommends that we have at least 150 minutes of moderate exercise per week. So these 3 lifestyle modifications are very critical and crucial in improving our health if we are diabetic.
All right, let's just tackle the food part, at least for this particular question. Let's talk about some affordable food swaps that diabetics can try to help manage their blood sugar. Everybody still wants to eat food that tastes good, so what can we swap that will be healthier?
So the first thing that comes to mind when I talk to my patient include fruits and vegetables. So thinking about your oranges, your apple, your bananas, those are affordable health choice that you can get at the store. Vegetables are very important. Broccoli, cauliflowers, your kale, all of those are very healthy. Always remember to incorporate or include proteins in your meal. We want to talk about eggs and beans. Those are very helpful. Now, one thing I want my patient to take away is if there's too much sugar, too much carbohydrate, too much fat, you probably shouldn't be eating them.
Okay, too much sugar, too much carbohydrate, too much fat. Do not be eating them. And there's probably lots of things in our pantry and our fridges that are like that. Okay, so exercise, you also said, recommended for managing diabetes. That can sometimes feel overwhelming to fit it in our schedule during the day. Are there some smaller, realistic steps that maybe we can start with?
Right. I mentioned earlier that American Heart Association recommended 150 minutes of moderate exercise per week. That sounds huge and unrealistic for most people, but I often tell my patient taking one baby step at a time is very helpful and also making exercise fun. So for instance, after breakfast, you can take about 5 to 10 minutes of walk. Do the same during lunchtime and dinner. If you have a lovely music you like to listen to, tune it up and dance to music for 30 minutes. At the end of the day, before you know it, you have about 30 to 60 minutes of exercise for that day. Now think about doing that for 5 days in a week. That is a total of 150 minutes of exercise. So this sounds difficult to attain, but it's actually doable. We can attain it by taking one baby step at a time and making exercise fun.
I like the idea of just turning up the music and dancing around the house. Okay.
Yes.
When it comes to stress, let's talk about that. They raise the blood sugar. Stress raises our blood sugar levels. What are some ways to help us to manage that?
Funny enough, exercise is also very important in improving or reducing stress level. Exercise is known to trigger the release of endorphins in our brain, and endorphin is what we call the feel-good chemical. So you have it in your body, it calms you down and relieve that stress. Meditation is very important. Mindfulness and meditation. Again, listening to music can be very helpful. Now, most importantly, getting that rest, 5 to 7 hours of rest per day, is very important. And I'll let you know, Tanya, family support can also help us improve our stress level.
Right now, we're going to talk about how diabetes, how we can make the most of the appointments when we are with healthcare providers and things of that nature. Sometimes I think we just go in there thinking that the doctor's going to take care of everything and that we're on autopilot.
So preparation is very important, Tanya. So before you schedule that appointment with your primary care provider, make sure you have all the questions ready, keeping your home glucose level, take note of your side effects and complications. And when you go for your appointment, discuss all of those side effects, medication options with your primary care provider so they can create a care plan that is suitable for you. Now, at the end of the visit, it's also very important to schedule follow-up appointment, and this is because it gives you the opportunity to connect with your primary care provider as often as possible to identify any complication and treat them whenever they arise.
All right, and so at what point should someone consider seeing a dietitian or a diabetes educator to help them manage their blood sugar?
Now, patient can be referred at any point in time. I typically refer my patient to a dietitian if, for instance, they are newly diagnosed and they have no knowledge about healthy meal plan. So dietitian can help them come up with a healthy meal plan. If they also have very difficult to control blood glucose level, it will be reasonable to refer them to a diabetic educator or a dietitian at that point.
Right, because just because you're told that you have diabetes and this is what your course of action is, doesn't mean it's always easy to figure out how to manage that. You need some help along the
Right.
way. Speaking
That
of
is
needing
correct.
some help along the way, you mentioned this in the last block. You talked about how family support really makes a difference. Let's talk about how loved ones can help us through this diagnosis.
Absolutely. Family support is very important. Even small action like joining in on exercise plan, meal plan, or even listening to your health concern might go a long way in improving your health in general. So absolutely, family connection, family support is very important in disease management.
And helps you leave the stress.
Absolutely, yes.
Okay. All right. So let's talk about some warning signs that maybe someone's blood sugar may be dangerously high or low and that they should seek medical help. That's definitely on the family side. We need to be able to recognize this.
Yeah, so signs and symptoms of hyper or hypoglycemia, in other words, increased or low level of glucose, can vary from one patient to the other, and they include lethargy, weakness, dizziness, excessive sweating. Sometimes, if their sugar is very low, there could be fainting and loss of consciousness. It's very important for patient and their family to familiarize themselves with these signs and symptoms so they can connect with their primary care provider as quickly as possible.
All right, so let's now delve into some common barriers. Again, this is Black History Month. We're talking about how Black and African American communities face some issues sometimes in accessing care. How should this be addressed?
Yeah, limited access to care it's a big deal in this patient population, and it could be due to cost, geographical location, as well as limited transportation. And ultimately, healthcare system can help come up with programs that mitigate this barrier, such as community outreach programs, mobile clinic, telemedicine, in which we bring healthcare into patients' home rather than patient coming to healthcare. So this will mitigate access to health in a way. Now, financial barrier is also very important, and financial programs such as medication assistance program might help them and go a profound way in improving their health in general.
As we're wrapping this up, let's talk about one message that you want people to take away about managing diabetes, especially for those who are impacted at these higher rates.
Yeah, so Tanya, diabetes is a very manageable disease as long as we have the right resources and the right information. You can get those information from your primary care provider, and that's why it's important for you to schedule follow-up as often as possible so that complications can be quickly identified and prevented or treated.
Okay. All right. And so if you maybe need to pass this on to a family member or a loved one or a friend because they're not able to see this interview today, we're going to have this in the To Your Wellbeing section of our website, WFMYnews2.com. Thank you so much for your time and your expertise.